Words in Anthony's mouth, by the way, and I like him. Today I walk in, I hear I'm going to fire him. I'm not firing him. I think he's a wonderful guy.
Dr. Anthony Fauci,
Thank you very much, Mr. President.
the most trusted member of President Trump's coronavirus task force, a veteran of multiple health crises for 6 administrations, now embroiled in a political drama. The hashtag #FireFauci, retweeted by the president's Twitter account over the weekend, fueling speculation about his trust in the doctor.
You tweet something that said fire Fauci. Why did you
fire Fauci?
I retweeted somebody. I don't know. They said fire. Doesn't matter.
President Trump trying to squash rumors and conspiracies.
Oh, I like him. I think he's terrific.
Well, I'm cautiously optimistic about it.
For more than 30 years, Fauci has been the voice America looks to for a simple explanation of the scientific facts, unafraid to deliver a reality check to both officials and Americans.
I've served 6 presidents, and I have never done anything other than tell the exact scientific evidence and made policy recommendations based on the science and the evidence.
Now he's the most visible medical expert in the latest crisis, appearing on hundreds of TV and radio interviews. His stature as an expert in infectious diseases began in 1984 as a new and mysterious infection, HIV, appeared in the AIDS epidemic ballooned.
Clearly, the way to disseminate the scientific information that becomes available is to do it through the scientific channel.
At the time, the young scientist leaning on facts to reject ill-informed misconceptions that it only affected gay men.
This can be transmitted, this virus, by heterosexual contact from women to men as well as from men to women.
Advising President Reagan on the deadly virus, who for years refused to acknowledge the disease even as thousands died across the country.
The way Tony Fauci stepped forward as a 30-something scientist at NIH and said, guys, this isn't immoral. This is a disease. Let's treat it that way. And the compassion and courage that it took at that time to step forward and say, we have to address this public health issue of HIV/AIDS, you know, it was heroic.
Fauci's assistant at the time, Dr. Margaret Hamburg.
He made us rethink how we do rigorous scientific research, that we can do it in ways that are responsive to the needs and concerns of patients and the urgency of the situation.
Dr. Nelson Michael also met Fauci around the same time.
Great leaders are humble yet bold.
That is definitely him.
He says Fauci brings his compassionate bedside manner to the way he briefs the country.
He and I both grew up in the era of taking care of patients where our diagnostics weren't that good. We watched patients die, patients that we really had become quite bonded to. So we've lived through some tough times. I've equated that to he and I being like combat veterans.
His work later recognized with the Presidential Medal of Freedom. In the midst of the bird flu outbreak in 2006, Fauci joined a choir of scientists concerned that a global pandemic was on the horizon.
Is there anything ordinary Americans should be doing right now as they watch this?
No, I think ordinary Americans should be doing exactly what they're doing, observing, paying attention to what's going on.
ABC's Terry Moran spoke with Fauci, who was already fearing a virus could mutate into something that could be transmitted through close contact.
He was saying at that time, at some point, we're going to get the big one. We're going to get a virus loose in the world that cannot be contained, and he was urging president after president to prepare for it.
Then when Ebola struck in 2016, Fauci wasn't just a voice at the podium.
Thank you very much to the doctors and nurses.
But also donned his white coat, treating patients stricken with the virus, like nurse Nina Pham.
I'll never forget those images. He's in his white coat, and he has his arm around her. He's saying, she is no longer a threat to you or the community. She is a human being. She can't give you Ebola infection.
Even when COVID-19 was barely registering with the public, Dr. Fauci had been sounding the alarm for weeks.
The issue now with this is that there's a lot of unknowns.
Then thrust into a higher profile role as a member of the White House task force.
America's top expert on that subject.
The nation's top doctor on infectious diseases, Dr. Anthony Fauci.
His relationship with the president has been put under a microscope.
There's become this little cottage industry on the right that portrays Dr. Fauci as this anti-Trump figure, as somebody who's trying to bring down the administration. It's really strange, but it has some serious consequences. There have been threats on Dr. Fauci, and they've actually had to provide security for him, something very unusual for a doctor toiling away at NIH.
scrutinized even more after an interview with CNN Sunday, in which he was asked to speculate on measures that could have been taken earlier.
You could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. But there was a lot of pushback about shutting things down back then.
Then the president retweeted that message with the hashtag #FireFauci. Yesterday, Fauci appeared to backtrack his comments from the interview.
The first and only time that Dr. Birx and I went in and formally made a recommendation to the president to actually have a, quote, shutdown. The president listened to the recommendation.
With one poll showing 78% of participants approve of his performance, compared to the 46% who approve of the president.
He has a remarkable ability to take a complex subject and then to make it understandable to anybody who's listening. And he does it with grace and he does it with dignity.
This is a moment when we need him, we need his vision, we need his energy, we need his commitment. And certainly those of us who've had the opportunity to work with him are grateful.